Hello, I'm Dr. David Gill.
And I'm Dr. Marla Bruns.
We're both behavioral neurologists and run the Memory Center at Unity. And we're here today to talk about Parkinson's disease because this is Parkinson's Awareness Week. So Dr. Bruns and I will have a conversation talking about some of the key topics about Parkinson's disease, hopefully answering some of the questions that you guys have about Parkinson's disease and what we can do to help in neurology and medicine in general. So,
A lot of patients come to me with a tremor and they're worried that they have Parkinson's disease. And so they ask, what is Parkinson's disease?
So Parkinson's disease, when I first trained, we were taught it was only movement problems, the tremor and slowness of movement. Obviously, since Dr. Brown's younger than me, you probably trained in the more modern era, which as we now understand Parkinson's disease, it isn't just movement problems with slowness of movement and tremor, but also involves some measure of memory problems and thinking dysfunction, and also problems with autonomic function, so difficulty controlling someone's bladder, difficulty with blood pressure. And there are a whole other constellation of symptoms that often go with Parkinson's disease, although not always. It can affect sleeping at night. People can act out their dreams. It also can affect other aspects of thinking and mood with anxiety, and sometimes can cause hallucinations. So it's a much more wide-ranging disorder than we once thought.
I agree.
And so one of the other questions we often get is, are there warning signs to tell when somebody's going to develop Parkinson's disease, or does it come out of the blue?
Sometimes it does run in families, but warning signs people usually get worried about are when they have frequent falls or their family member is falling a lot. Obviously the tremor does worry some people. But there is also a familial tremor, which can be different from Parkinson's disease, but it's always good to ask and find out first. Warning signs such as dizziness upon standing can sometimes be an early sign of Parkinson's disease. Tripping, it may not be complete falling, but as you're walking and have shuffling steps, that might be more likely to make you fall. Also more stiffness. It may not be arthritis. It may be more difficult to move when people shake your hand. It may be a stiffer grip. Also, I think difficulty swallowing, and like you mentioned, the sleep disturbances. Moving a lot in your sleep, acting out your dreams, those types of things.
And we now know there is sort of a prodromal phase to Parkinson's disease that can begin really as many years as 20 years before someone develops the tremor and slowness of movement. And some of the things we talked about tend to occur early in the prodromal phase. Acting out dreams at night, constipation, and poor sense of smell. And so sometimes we get referrals for people with some of those features, most often acting out dreams at night with a question of, is this going to go on to develop into Parkinson's disease? And we now understand that Parkinson's disease is at some level caused by a buildup of proteins in the brain. And we think now it may actually start outside of the brain in the nervous system of the gut and in the olfactory system, the smell system of the brain, which is maybe can explain those prodromal symptoms and why those symptoms start prior to Parkinson's disease. On the other hand, just because you're constipated and have a poor sense of smell, it doesn't mean you're going to go on to develop Parkinson's disease.
Right.
I think we're back to me, right? I missed that.
Yes, a lot of times patients come into memory clinic with behavior problems, and we often ask, has your loved one had a change in their personality? But this can come outside of memory clinic too, and commonly in general neurology clinic we see Parkinson's disease patients. And do Parkinson's disease patients have changes in personality?
So a change in personality is a somewhat hard to define thing. So what does that mean? We all have a personality, and I guess that can change normally with aging. And is there a dramatic change that occurs with Parkinson's disease? The answer is sometimes yes, and oftentimes no. So some of the classic changes with personality really involve more mood than personality. So people with prodromal Parkinson's disease and with Parkinson's disease are more likely to have anxiety and depression, which is fully treatable if you see a provider and get treated, and that obviously can cause a change in personality. There's also no doubt that it can lead to a change in motivation, where people are less motivated It's also interesting too when you look at aspects of personality in somebody who goes on to develop Parkinson's disease. There's this distinction about somebody who has a high risk behavior personality, somebody who likes to gamble and that type of thing. Interesting enough, people who are prone to develop Parkinson's disease often have an aversion to high risk behaviors. So sometimes that type of personality change can occur as well. For the most part, dramatic changes in personality that we sometimes see in other causes of dementia, like frontotemporal dementia, we don't often see in Parkinson's disease. And for the most part, personality does not change dramatically in somebody with Parkinson's disease.
I too see a lot of apathy and depression in my Parkinson's patients, and I think this question may arise from one symptom I haven't mentioned about Parkinson's disease, which is the masked facies, which literally means when the person looks like they're wearing a mask. And so when someone loses the ability to plan their facial movements, their smile, that can look like they have a change in personality, but really behind the mask, they are the same person. And so it's important to not change your attitude towards the person.
Right, exactly. So they, behind the scenes, behind the mask, often are the same person. Yeah. And so we mentioned memory a couple times, and we talked about that being a part of some people with Parkinson's disease. So is dementia something that always happens if somebody has Parkinson's disease? And what's the difference between dementia and Parkinson's disease and Alzheimer's disease and things like that?
A lot of people come to my office, and I'm sure yours, thinking that dementia and Alzheimer's disease are the same thing, but in fact, dementia is an umbrella term that describes any problem with thinking, language, memory that gets worse a little bit over time. Alzheimer's disease is the most common cause of dementia, but Parkinson's disease is also a common cause of dementia. And while it doesn't occur in all patients with Parkinson's disease, it happens in 80 to 87% of patients with Parkinson's disease. And it originates from the disease itself, not necessarily not the medications that we use to treat Parkinson's disease, which was another question we got. But there's another disease that causes dementia too, called Lewy body dementia. You may have heard about this with Robin Williams in the past year. But both Lewy body disease and Parkinson's disease are caused by the same pathology, the proteins that build up in the brain, but depending on where those proteins build up in the brain, you will have different symptoms. So when those Lewy bodies spread throughout the brain, that is what causes the dementia, not the motor symptoms.
And thinking about Parkinson's disease as a continuum or gradual progression, there are some mild memory problems that can happen before the memory problems get severe enough to call it dementia. And so there can be changes with thinking, even at the time of diagnosis. They tend to be subtle and are more involving speed of processing, focusing attention, and less so with memory and things that may occur later and be a real challenge, more of a challenge for the person to remain functional.
Right. The memory of how to do something is there, but it just takes longer to do it. And we can help you with that. There are lots of things you can do to help yourself too, to keep that processing speed up. And that's probably a good segue. If a loved one has been recently diagnosed with Parkinson's disease, what can they do? And as a caregiver, what can you do to help them?
So a very good question, and one that we get a lot and people often have but don't ask. Some of the key features about Parkinson's disease that are important to remember, either if you're being diagnosed with it or a loved one has it, is that Parkinson's disease does not affect the overall lifespan of someone, meaning that someone does not pass away of Parkinson's disease. Unlike some of the other disorders that we see, including frontotemporal dementia and Alzheimer's disease, it definitely does shorten someone's lifespan. The other thing to keep in mind is that for most of the symptoms of Parkinson's disease, especially early in the course, they're very effective treatments. So the slowness of movement and tremor, in particular the slowness of movement and gait dysfunction or gait problems that somebody has with Parkinson's disease, responds very well to the medications, often at a low dose. And many times, you probably feel the same way. If I see somebody with idiopathic run-of-the-mill Parkinson's disease, I'm often eager to see that person because I know it can treat them and make them quite a bit better.
Right.
And so that's something else to keep in mind, is that the treatments that we have for Parkinson's disease are quite effective. And as new symptoms develop, we have treatments for those as well. And so it's important for people to get diagnosed, make sure they receive specialty care in a neurologist's office, and make sure the person has expertise in caring for people with Parkinson's disease, because it really can improve their quality of life and make it near normal for a large number of years. And I think along with that reassurance, it's also important to become educated. So I think that not only is it important to get the right diagnosis, but make sure you get information from the provider and from the clinic, but also to access the support organizations in town, because they have a lot of good information, not only online, but also have support groups, exercise programs, and educational programs in our community right here in Rochester that provide support and also provide a lot of expertise to the caregivers, making them feel much more comfortable with caring for that person.
Right. If your family also has questions, but you don't want to explain everything to them, those local support services and the Parkinson's Disease Foundation are excellent sources. There's also a lot of exercise programs available, and probably the take-home message I give all my patients is the best thing you can do for your brain is to stay active, active, active. Stay active physically, stay active mentally, and stay active socially. And you know, improving your balance, improving your core strength, improving your walking, all those things. There are tried and true methods for walking big, talking loud, that all improve handwriting, balance, and Parkinson's disease specifically.
Right, and being physically active is incredibly important for people with Parkinson's disease. And we know from studies that the more active they are, the better their walking stays. Mm-hmm. And there are other things that we know work that are specific to Parkinson's disease that you mentioned, but also things like Tai Chi that focus on balance are very effective for Parkinson's disease. And so being involved in those activities can really help prolong how functional, how good someone's quality of life is with Parkinson's disease.
I have to slip this in there too. Tango research for Parkinson's disease has also been helpful.
Dancing is great. It's mental, it's social, and it's physical.
That's my line.
And it's popular sometimes more with one part of the couple than the other.
Yes. But it's never too late.
That's right. That's right.
Have we gotten any other questions online, or?
Great. Well,
Okay.
It's been enjoyable talking to you about
Yes.
Parkinson's disease. Hopefully
Yes.
everybody learned a little something. They're always welcome to get in touch with us if they have other questions or like to see us if they have questions about whether they have Parkinson's disease or not.
Mm-hmm.